I'm your host, Phatman.
And I'm Little Boy.
This is our weekly Netcast podcast, although we missed last week for the middle of July 2012.
July 16th.
Yeah, no more weeks. I don't do that anymore, so as you guys know. We've been gone a couple of weeks again. That's actually 100% my fault this time.
I hope this is recording.
Yeah, it is. I normally
scheduling conflicts.
I normally blame it all on Little Boy, or it's both of us, but not this time. This time it was actually me. I was lost my mic. I was we're working with another show, as everybody knows, the Pound for Pound Sports Hour, and it just overwhelmed my time last week. But I really missed doing the Phatman and Littleboy show, and I've missed doing the Phatman show.
Yeah.
You know, that hasn't happened in months.
No. Put on the back burner.
Yeah. But we are in talks, we're talking in the pre-show for radio and television here in San Diego. So Phatman and Littleboy show will be coming to you weekly. I want to spend a lot of time doing the show weekly because if it works out, Little Boy, I'm telling you a little secret that you don't know yet.
Okay.
We might be on San Diego television.
Oh, really?
Oh, really? So think about that.
Yippee.
So anyway, just found that out this afternoon. So there you go. Well, Little Boy, how was your last 2 weeks?
Been pretty busy. You know, we both lead pretty busy lives. Things have been going good. I actually want to take a moment to thank the Phatman family. We went out to the homestead yesterday for your birthday. You turned, do you want to tell everybody?
40 years old.
40 years old. And
so you can't ask me my age anymore. It's against the Age Discrimination Act.
Now, how old do you have to be till you start getting the 25-cent coffees and stuff like that?
I got 15 more years.
Okay.
Although, for my birthday, I received a metal detector, which I will be going down to the beach, and I will be finding rings and everything that all you young whippersnappers left.
If you see the big guy in the Hawaiian shirt and the shorts and the sandals with socks with the headset on, walking around the dragging something behind him, that is the Phatman.
That's me.
Looking for your ring.
Yes, and I'll find it. And then when I find it, you will you can get it back at half price.
Yeah. But
I'm a true capitalist.
Like I said, I wanted to thank your family. That was very nice. We a lot of them I had met before, a lot of them I hadn't met, and they welcome me and my family in with open arms. They're much nicer than you.
Yes.
But
yeah. And
that was great. We had a great time.
That was half my family.
Yeah.
Everybody ate all the food. Normally we always have extra food. I mean, I am the fat man, although I'm the heavy one of the family.
They blamed my family because the food got eaten. I think is what it was. They said,
well, there's the trait of the fat man in there. Yeah. Well, anyway, we have a lot to talk about tonight, and I really want to get to it. Obviously, the first thing I want to talk about is Well, go ahead.
No, we're a few weeks behind because we missed a couple weeks, but
the health care bill passed. Unbelievably, the health care bill passed.
Yeah, I was surprised. I didn't think it was going to. I'm very very happy that
it did. Passed pretty much in everything except for one thing about commerce, but it passed straight away. I did think it was kind of interesting because what the justices did say, and they're absolutely right in it, was the fact that Congress does have the right to tax. Mm-hmm. And if they want to tax you, if you don't buy insurance, Congress has the right to tax. That law was,
it's like a tax penalty.
Well, it's still a tax, I'm
right.
just saying. But Congress has the ability to do that. And that actually, nobody thought of it that way, to be honest. I never did. Did you?
No, that one threw me off. As a matter of fact, people were really banging on Fox News, but CNN did it as well.
Oh, yeah, all of them do it now.
What I'm saying is Fox News and CNN both, because first he said that the way that he worded it was the way that it was. The mandate was not constitutional. So as soon as he said that, Fox News and CNN both got on there and said the ruling is unconstitutional. And then all of a sudden,
first day, right,
and because everybody, it's funny how news has become. News is not the same as it used to be back in the 70s and even 80s. News is a money-making thing now.
Of course, it is. Of course it is.
It used to not be. It used to be, news was there to report the news, and that's not what it is. It's turned into all for profit, and they're all about, I need to scoop this guy, so. And you remember the whole George W. Bush, Al Gore thing where everybody was calling the states, because they wanted to be the first one, because everybody, the news, they want to be able to say, we're the first to report this, we're the first to do that, we're the first to do that. Well, both of them screwed up, and they both reported it wrong, and people were actually, a lot of people were laughing at Fox News, but CNN actually did it as well. They both reported it wrong because they wanted to be the first to report it. Ended up finding out that it was constitutional, but not as a mandate, as a tax, as a tax penalty.
Yeah, and that interests me because one of the things that didn't pass was the commerce section, where if you're under 50 employees, you just have to have it available, but you don't have to provide it.
You don't even have to have it available. You don't have to do anything if you're under 50 employees.
Oh, I thought you had to have it at least available.
Nope.
So you don't have to do anything.
Nothing.
Well, what happens to those people who have 50 employees?
Businesses with fewer than 50 workers are exempt from the requirement to provide coverage or pay a penalty to the government. They don't have to they don't pay a penalty to the government.
Wow. So basically, what if you work for a company? But now here's the thing:
if you have less than 25 employees, if you have less than 25 employees, I think also 50, if you choose to provide health insurance, you actually get tax credits for that.
If you choose to
right. So this is actually, people are talking about it's going to kill small business. It's actually going to help small business.
No, and you know what? The thing is, I that was the part of it that didn't pass, where small businesses would have to provide it. But
the part of it that
was the commerce section of it, which was a number. See, at the original was every business, if you had an employee, you would do it, but that didn't pass. It didn't pass Congress years ago. This is when they first started.
Okay.
Didn't pass it, and the watered down version was 50 or more, but it was you had to provide it. There was something about commerce that you had to provide it.
No,
you have to pay for it, but you had to have it make it available. But this is where I'm coming from. Just let me get to it.
Okay.
So small businesses in the country, there is, I believe it's either 85 or 90% of all business in the U.S. is small business. You know what I mean?
Right.
They're the larger employer.
That small business number is a little skewed just because...
Well, if you drive down the street, you don't see, General Electric on every corner, but you see mom and pop.
Well, when you think of small business, you think of mom and pop, and you got to remember, there's a lot of people out there. Like, for instance, if you were out giving speeches and stuff like that, like corporate speeches and stuff like that, you'd be considered a small business.
We're a small business here,
right? But I'm talking about like Bill Clinton, when he gets paid for he's considered a small business.
Sure, but in the U.S., isn't it true that small business is the main employer?
I would believe that. I don't know. I haven't looked up the numbers.
Even
I would believe that.
Well, I think you're a medium-sized business because there's quite a few employees there. But large business where it's over thousands,
Right. Yeah, we're not.
It's not that. But small business. So if you're under 50 employees, it didn't affect you at all. But what about the employees? It affected them.
What do you mean?
Well, because if you were a small business and you had under 50 employees, now you have to tell your employees, look, go get your insurance or you're going to get fined.
No, they're not going to get fined.
No, the people.
Well, the funny thing is about that.
I'm not talking about the business. I'm talking about the people.
But it will be made available for them to buy. The thing about first of all, I don't know why Republicans aren't grabbing hold of this and being happy about this.
But they don't want the thing that they're fighting right now, or they were fighting, is the mandate.
Yeah, but the mandate it requires personal responsibility.
I know it does, but there's some people who don't want to have insurance. They don't want to pay for it. And so basically what's happening is you're saying if you don't pay for it, you're going to get taxed for not having it.
The problem is, though...
Now, does that sound good? It sounds great, but what if they can't afford it?
Well, if they can't afford it, then there's...
But
I don't have the numbers
who says
in front
what
of me.
they can and can't afford?
Well, they have numbers. They have income levels.
Yeah, but you have a good salary, right? But just like me, it is never enough.
You're right. Let's take me, for example, because actually I wanted to talk about this. Now, I'm not going to tell everybody what I make. I don't make a ton of money, but I make enough to live. My health insurance, when you count my health insurance and my dental insurance, we're paying over $900 a month for insurance. Now, what if somebody else in my exact situation, or what if I decided, you know what, forget this, because I'll take that $900 and I'll get a bigger house, $900 a month, and I'll get a bigger house, or I will get a better car, or we'll go on bigger vacations. I'm going to use that money for that because who cares? If somebody gets sick, they got to treat us anyways.
Okay.
They have to treat us anyways.
Okay.
So it's taking somebody like that and saying, you know what? No, you have to be personally responsible. You have to get health insurance because what you're doing is you are putting the burden on the taxpayers.
But what if you didn't have
that.
insurance? What if you didn't have it? Or what if you could no longer – because you get it through your work. What if your
not
business,
if you don't have the money. You don't.
Well,
you don't
she couldn't hear it.
Right.
What if your employer did not offer it to you because they don't have to anymore? And I mean, you would have to come up with it. Now, the thing I don't like about that,
the way about the new law though is it will be available. Insurance will be available,
but you still have to pay for it. You have to buy it. It's not going to come to you free.
Of course.
Which I completely like. But what I'm saying is, I just don't like if there is people who will not be able to afford it.
Right.
They won't. I know that there's people.
Then they won't have to pay for it. They have
no. I mean,
levels.
they make enough money, but their bills are so where they're at. That happens. Well, there's a lot of people like that. You don't understand, little boy. There is people like that.
Sure.
And they're not bad off that they can have welfare, but at the same time they're not so good.
You have to make choices.
So what do they do? Move out of their homes?
You have to choose health care over maybe cable television, or maybe over your jet skis, or maybe over your boat.
But that's
or maybe
you might be going the wrong distance.
Well, I
completely.
might be. I'm saying there are people.
What
like
is the number? What is the number that it cuts in at? I mean, who knows?
Nobody will know. We won't know. We won't know until it happens. And let me tell you, how many people are in the United States?
300 million.
Is there going to be a law that's going to be ideal for 300 million people?
No.
There's not.
But now
but I feel that this law is what's best for the United States. Is it perfect? No. And I have no problem talking about it and maybe making adjustments to it. But the problem is, all they're trying to do is rip it out. You know, they just want to. The Republicans keep trying to get rid of it over and over again. You know, I'm gonna go off on a tangent a little bit here.
Yeah, because you're already going off a tangent.
The problem with
it is a Phatman and Littleboy show.
It's about freaking time. You know, the problem with politics in the United States, and I am guilty of it too. I'm not going to sit here and point my fingers. We've turned it into sports.
Well, it is sports.
We've turned it into sports.
It's fun to talk about.
When this was not struck down by the Supreme Court, Democrats all went, "Yeah, we won," and Republicans all went, "We lost," you know. And we need to stop treating things like that. You know, everything that George W. Bush put out there to do, I was against.
Yeah.
Why? Because he wasn't a Democrat. And everything that Barack Obama presents, all the Republicans say, "No, we can't do that. I don't care." You know, not even I don't care if it's good. I don't even want to look at it and think if it's good. I don't even want to decide if it's good. It came from them. They're on the other team. We're not going to do that. And that's what politics has turned into in the United States, and it's wrong. And we all need to change our train of thought, and we need to say, okay, look it. Right now we have a Democratic president. Do you really think that he is out there going, you know what? I got an idea. Let's ruin America. I think this is going to screw. He is Please. Please. He is. I hope that they weren't close up on me. I hope that your face was on that. I'm not sure. He is out there doing what he thinks is best for the United States. And instead of just saying, well, this is Barack Obama's idea, so we're going to be against it, why don't we try and work with it? Say, okay, you know what? Let's go with it. Let's try and tweak it a little bit. But Republicans aren't talking about tweaking it. It's not. It's gone. We want it out of there.
I still don't like it. You know how I feel.
Right.
There's parts of it that I do like because of the fact that every time I go to the emergency room and I pay my insurance, that the place is freaking packed with people that have kids that have a temperature.
And have not paid. You know? Yeah, and that's another thing.
And that annoys me.
You know why? Because they don't have insurance, so they can't go see a doctor. It's emergency room or nothing.
But the plight of the Democrat is always to help all the little guys, and I don't think this does. Because the big corporations...
We don't know.
Well, I lost my mic. This is going to become a problem. The only thing I don't like is that...
Try tightening the thing. I tightened it real good.
I'll deal with it later. So I don't like that you're going to take somebody who can't afford it and tell them, look, get rid of your personal belongings.
I think that the demographic that you're talking about there, I believe, is very, very small.
I don't think so. Because,
I think it's very, very small.
They changed the welfare laws in California. If you make $800, you're no longer getting welfare. Well, $800 in an economy where you can't find a job for minimum wage part-time doesn't take long to not make $800. I mean, there's people making $250 a week, and they would be exempt from getting the welfare health care.
Let me explain something to you. If I stopped paying for the $900 a month that I was paying right now for health care, and in, let's say, 9 months, my wife and I sat down and decided we need to get health care again we need to start purchasing again, we wouldn't be able to afford it by then.
I know.
Because we will have found other places to spend $900.
Right. Or your
the
kids
problem
going to
is,
college or whatever.
for the most part, how much time are we at?
15.
Okay. For the most part, I really think that you can afford it if it's important enough to you.
Well, it is,
and
we
you
all
need to make
but
sacrifices.
We pay for it.
And when I talk about sacrifices, I am not talking about sacrificing beans and rice or something. I'm talking about you need to sacrifice, the if you need to sacrifice the cable. All these things we have come to expect or have gotten used to as necessities are not necessities.
So let me ask you the next question, because I don't want this to take our whole show, but it seems like it's going to.
It might. I thought that it might when we got here.
The next question is, who pays for the people who can't afford it? Where does that come from?
Who's paying for the people who can't afford it now?
Well, right now, the people who can't afford it,
who's paying when they get health care now?
Well, what happens is they go to the hospitals.
Mm-hmm.
The hospitals bill them. The hospital doesn't get repaid.
Right.
So the hospitals pay for it.
Well,
and then
what do
they
the hospitals do with that?
They raise up the rates.
Exactly. And
right.
So who's paying for it?
You and me.
Okay.
But who pays for it now?
You and me. Still.
But now
it will be readjusted.
So how did it help you or I?
It helped you or I because we live in the United States, and the more people with health care, the more people that are healthy, the better for the country. That's how it helps.
But they could have had health care before.
No,
they can go in. No, but they can go in before.
There are people. Take my family, for instance. We'll go back to that. There's lots of families that are in my same situation that do not get health care. And now they will have to.
They'll have to.
And that's
what my issue is.
And that's the type of thing that I'm surprised the Republicans aren't embracing, is the fact that they want people to take personal responsibility.
They just don't want government to tell them to do something.
Well, of course
that's
they don't.
Always been a Republican
thing. Do something. But sometimes you need to be told to do something.
No, I don't want to be told to do anything.
Too bad.
I get my own insurance. Nobody told me to ever do it.
Yeah, but what about the person who doesn't?
That's their problem.
No, it's not their problem, though. It's your problem.
Now it's my problem because now I have to have it.
It's your You have it already.
But I have to now.
So what does it matter?
They're telling me to do it. I don't like to be told what to do. What do you mean, so what?
It doesn't affect you.
Where's the freedoms of life?
It affects the people that are not paying for it who should be.
But I have to now. I had it before.
You already do.
But I don't want to have to do it.
Doesn't matter. You do it.
It doesn't matter. I do it because I want to do it. Now I have to do it.
That is so
strange. No, it's not strange.
That is so strange.
Your deal is you want government to tell somebody what to do. That's what I don't like.
If they're not doing what's best for everybody, then maybe what they're doing.
It's none of government's damn business.
You know what they're doing? They're taking advantage of everybody. Is what they're doing. They're taking advantage of the fact that the government tells that hospital, you have to treat that guy whether he can pay or not. The hospital's been told that. Government's telling that doctor, you have to treat that person whether they pay you or not. You have to treat that person. So why can't they tell that person, you know what? You have to pay.
But they do have to pay. They just don't.
No, they don't have to pay.
They can go to court and sue them and everything. That's absolutely what they can do. I don't want them to tell me to do anything.
Too bad.
Government, and that's the problem.
Government tells you to do things.
It takes freedoms away.
The government tells you to do things.
And I hate it.
They're not. You have not lost any freedom because you already get health care. You already pay for health care.
I have lost the freedom. You know what? I have lost the choice to have health care or not.
Yeah, but
is that when you choose? Okay, hey, we're gonna use the same logic that you just told me.
You were taking advantage. You were taking advantage then. You were saying, you know what? I'm not going to pay. I can pay, but I don't wanna. I'm going to take a free ride. I'm going to make this guy who rules. He has to treat me. He has to make me better. But you know what?
Are you saying that everybody who doesn't have health care has used the system?
No.
Well, then there you go.
No.
Because what you're saying is if I choose not to do it, then it was still go to the hospital. I didn't say that. I choose to have health care because for me, I need it. I chose.
If you chose not to.
But now it's no longer a choice.
If you chose not to get health care and your bank account had $15 in it because you don't get paid for a week, which we've all been there before, and you are walking out there working on your yard and you fall off the wall and break your leg, what are you going to do?
Go to the hospital.
And what are they going to do?
Fix me.
And how are you going to pay?
I'd have to go on a payment plan.
Or not pay at all, which some people choose not to do.
If I don't pay at all, I have assets. They come get them. They take you to court.
What if you don't have assets? What if you
attach
you have a drug
bill?
Problem? What if you have a drug problem?
I don't have that. What you're saying is so what you're saying is they have taken my right away to choose. What would you do if government turned around and said you no longer have the choice of to have abortion or not? I mean, what's the difference issue here?
Different issue.
No, what is the difference? The government, we're going long. The government, the government is now, they're yelling at us in the booth. The government is now telling you don't have a choice. You must. What is the difference?
They say that with a lot of things.
Yeah, but what I'm saying is you're all okay with this, but if they turned around the government and said, you no longer have the freedom to choose if you want to carry a baby or not, you would have a thing with it.
That's a different issue, though.
Why is it a different issue? It's still a choice. It's still a choice. It's a choice. It is a choice.
What if the...
What if
the government said you don't have the choice to decide whether or not you want chicken or beef tonight?
That's what I'm talking about, but that's where it gets. I want choices.
It's not getting there.
I want choices in life.
It's not the same thing. You're not comparing them to the same.
It doesn't matter. It's still the same thing. It's a freedom loss, and every freedom loss is just a beginning for them to take another freedom. This would never have happened 20 years ago, would it? Yes or not? Yes or no? We're not rapping.
It is the Phatman and Littleboy show, right?
Yeah,
so we can go long if we want.
It's the Phatman and Littleboy. And it's PMLB Media. That's us. We own it. We're going along.
They
Shut up.
Telling us to wrap it up. That's why we keep doing that.
Yeah, somebody's going to get fired. Anyway.
When we go on TV, we won't have a choice.
Yeah.
We still have that.
We got that choice.
We still have that choice.
Do we have a choice? You see what I'm talking about?
I feel like that freedom being taken
we
from
didn't
you.
get into any other stupid subject, but all I want to talk about was, and what I want to say, isn't this whole show
we can talk more about healthcare, too. We can get into
I don't like when you lose a choice. When you start losing choices, it's a slippery damn slope. And that is going to happen.
I don't think it is.
Next week, they're going to tell you can't wear red.
I will bet you $100 that they will not.
Well, what I'm saying is it's stupid that
exactly.
that
is stupid. Saying that is stupid. You were right. We agree.
And
that is stupid.
And what's stupid is when the American people allow that to continue. Oh, boy. Well, I guess we're going to have to stop.
I guess we lose.
We lost because they have the switches inside the studio. Now, this is the Phatman and Littleboy show. You could always reach me at phatman@phatmanandlittleboy.com. We really want to hear comments on this show.
Yeah,
I want to know what people think about this healthcare issue.
Yeah.
And I know that, we're getting a few thousand people out there watching it.
And one thing, we only covered a small portion of it. We can do, we're not going to do every show on healthcare because it would go forever. But we'll get into healthcare again some more. Especially, I think when the debates start going is when we're going to really be able to get into healthcare. You can reach me. I'm Littleboy at phatmanandlittleboy.com. You can tweet me direct at lbhost. And
my Twitter handle has changed to Producer Phatman, which I got like 5 on here right now, as I didn't get any chance to give a shout out. Sorry about that.
That's okay. We'll be back next Monday.
Yeah, we will be. Littleboy, it's been a good show.
It's been a great show.
And we'll see you real soon.
Take care.